So in this issue of Manual Therapy Monday, I want to talk to you guys about two things that you can do for your manual therapy techniques. The first thing I want to talk about is sparing your hands with your techniques. And so there's a couple different ways that we can do that. And so typically, we can we get it in with our hands and we'll do all of our mobilizations. And over time, our joints as manual therapists might get achy, even if we are using the proper biomechanics. So instead of doing that, what you can also do is use exercise or bands to help assist any motion that you would like. The second thing I want to talk to you about is using bands and other forms of weight or load to help expedite your manual therapy process. So whether you're trying to increase motion in a joint, increase soft tissue extensibility, you can basically use extra load to help load the affected tissues to get a better outcome. It's been my experience, as manual therapists, sometimes we give up too soon on a technique because we're just not getting the adequate result. And perhaps we're not applying enough force. And so applying an extra band or load with a weight to increase the amount of mass and momentum at the joint or the soft tissue might feel perhaps can increase your outcome. So stay tuned for a couple more videos on how I apply this with the thoracics. All right, so now we're going to apply these strategies with our manual therapy concept. So today I have Pat here on a thoracic roller, or extension, or a foam roller rather, and we're gonna do some thoracic extension. So Pat's just gonna go ahead and take his hands behind his head. So instead of me, cranking away and doing my PA moves or manips, I can come here and kind of actually help expedite the mobilization by having him just kind of drive his neck back over the roller, and I'm just helping him extend his spine. So I can kind of push his sternum up as I do this mobilization. And then I can also do is take my hands and just kind of push down on the transverse processes and spinous processes to facilitate those motions. And so this is really great because I'm not, cranking away at my wrist joints or my arm joints. I got gravity pushing down. I got my hands helping that as well. So there's a lot of good things happening. And so to apply some of the other strategies that we talked about, we can have him just increase his speed as a way to get more force to that affected area. So go ahead, Pat, just kind of go ahead and provide a little bit more force to that. Great. And he just dropped his phone. All right. And so the other thing we can do is add a weight. So Pat, sit tight real quick. We're going to apply a weight now. So go ahead and put this in your hand for me. So go ahead and hold two hands overhead, and then go ahead and come up, and then come back down. Perfect. So as you guys can see, that's two simple strategies that you can apply with any joint, any manual therapy technique. So as long as you know the reason why you're doing what you're doing, you can create exercises in any sort of exercise strategy or manual therapy strategy. And you can do this to help protect your hands, so you can be clinician for 20, 30 plus years without achy joints, but also you can use these techniques and strategies to help expedite the healing process or whatever you're after with your patients. So if you haven't already, I do have some different techniques similar to this in my ebook. So if you haven't already, please go to my website, scottgraypt.com, and download my free ebook.